Welcome to the 700 Club. This is the day the Lord hath made, and we will rejoice and be glad in it. Nevertheless, economic meltdown. That's the prediction if the government doesn't take quick action, all because of the coronavirus shutdown. So what's the president's economic prescription, and how will it put money directly in your pocket? George Thomas has the details.
As businesses are closing across the country to stop the spread of the coronavirus, the administration is proposing up to $1 trillion in aid to help those affected by the shutdown. The plan includes sending checks directly to Americans.
Americans need cash now, and the president wants to get cash now. And I mean now, in the next 2 weeks.
Mnuchin now warning the unemployment rate could hit 20% if the government does not step in. More than 7 million jobs are now at risk at restaurants and bars across the country. In the travel industry, nearly 5 million jobs at risk, with hotel chains planning to furlough thousands of workers. The relief plan also includes $500 billion in a payroll tax cut, $50 billion for the airline industry, and $250 billion for small business loans.
With this invisible enemy, we don't want airlines going out of business. We don't want people losing their jobs or not having money to live when they were doing very well just 4 weeks ago.
It comes as the virus has now spread to all 50 states, and more than 100 Americans have died.
We're asking the young people to help us with this mitigation strategy by staying out of the bars, staying out of the restaurants, really trying to distance yourself.
At least 22 states activating the National Guard, and more than 36 states have canceled public schools. Healthcare workers are bracing for a surge in patients and a shortage of medical supplies. The Pentagon now providing 5 million respirator masks and 2,000 ventilators to Health and Human Services in response to the outbreak. The Defense Department is also making its 14 certified coronavirus testing labs available to test non-DoD personnel. The Navy is raiding 2 hospital ships for possible deployment to assist with patients who don't have the virus, freeing up valuable hospital beds. Meanwhile, Border Patrol will return to Mexico all immigrants entering the U.S. illegally, with the administration saying it cannot risk allowing the coronavirus to spread through detention facilities and beyond. George Thomas, CBN News.
George, we're going to be talking with our CBN medical reporter in just a moment. But first, let's talk about the economy. Stephen Moore is here with us. He's an economist with the Heritage Foundation. Steve, what do you think about the stimulus package? Is it the right amount, and are they going to put it out in the right quantities for to make a difference in the economy?
Well, boy, Pat, these are tough times, no question about it. Just listen to your report. And, you know, I'm here in Washington, D.C. This town is pretty closed down. I have a son who lives in San Francisco. They've basically got a lockdown in that city, and New York City is the same way. So this is going to be a very tough time for the American economy over the next, you know, hopefully just 6 weeks or so, and until we get this virus contained. Now, I think the president is taking some appropriate action. Some of the things I like, Pat, and some of them I don't like. I think one of the more important things that the president has called for is a program where healthy businesses, you know, we have 26.5 million small businesses in this country. A lot of them are going to be suffering over the next, you know, couple of months because they're not going to have customers coming in the door. And those healthy businesses, you don't want to see those go bankrupt. That doesn't help anybody. It doesn't help workers. It doesn't help customers. It doesn't help the people who run those businesses. To allow them to get a loan from the government, a short-term loan, Pat, that would let them have the money so they can meet their payroll and they can avoid bankruptcy. So once this is over with, those companies can spring back to life. And I think that's one of the things the president is proposing. I like that idea a lot. The idea of sending people a $1,000 check, I think that's fine for the short term. But, you know, Milton Friedman taught us you can only give somebody $1,000 if you take $1,000 away from someone else. So I think it's more of a redistribution tool. It'll help people in the short term. But one of the things that Art Laffer and Steve Forbes and I have been saying is what we do to rebuild the economy when this is over, we want to make sure we're doing things that are healthy for the economy and then incentivize people to work and for employers to hire. That's why I do like the idea, Pat, of suspending the payroll tax for businesses and workers through the end of the year. It'll give incentives for people to work more because they'll get a 7% raise in their paycheck. And also it reduces the cost of businesses to hire workers.
Steve, who is going to pay for all that? If we're talking about it's almost $1 trillion, I mean, where does the money come from? We just added the debt.
Yeah, it's some no good options here, Pat. I mean, you're right. We're going to have to borrow right now. And at least the good situation is that, thank God, Donald Trump created this incredibly strong economy going into this. I remember a month ago, we had 300,000 new jobs created in the economy. In the month of February, we had the economy growing at 3 to 3.5%, much faster than any other country in the world. We have 6 million surplus jobs. So we had a sturdy economy going into this, and that's the good news. Now, we are going to have to borrow. And the other piece of good news, by the way, is, I'm a fiscal conservative. I don't like running big budget deficits, but we got to get through this. And at least if we borrow now, because the interest rates are so low right now, Pat, the federal government can borrow at essentially 1% interest. And so that's not, the cost of borrowing right now is pretty low. But I agree with you. At some point, we're going to have to start getting back to balancing the budget. But right now, we've got to get relief to the economy so it doesn't crash.
Steve, what's the mechanism? Is the Fed going to open the Fed window and let the money come out? I mean, if there are going to be loans to people, what mechanism is going to be used?
Yeah, that's a great question. So you could use the Treasury Department. And by the way, for the first thing you want businesses to do is go to their local bank, and get a line of credit with their banks. And this program that I'm talking about and the president's talking about would only be if your bank doesn't have enough money to lend you money. Then you go to the Treasury Department or the Small Business Administration or directly to the Fed. But the main point is making sure that these businesses don't have to sell off their assets, because they're not going to have revenue coming in. A lot of them don't have customers. If let's say you own a restaurant and it's closed down, I mean, you're talking about maybe 8 weeks of not having any revenue. So that's going to be a tough thing for these businesses. Pat, you and I have lived through these crises before. We lived through 9/11. We lived through, remember the Y2K crisis. We lived through what happened in 2008 and 2009 with the mortgage meltdown. The most important thing you want to do is put in place policies that are actually good for the economy. And I've got to say this because I'm listening to what Nancy Pelosi is saying. And as you know, the president is negotiating with the speaker right now. And unfortunately, every policy that Pelosi supports is actually bad for the economy. She wants, for example, think about this. She wants businesses that are financially strained right now to require them to pay paid leave to their employees. Pat, where are they going to come up with the money to pay for that? They're not ATM machines. And then she wants expanded unemployment insurance. She wants food stamps. And these are the kinds of things we tried in 2009 under Obama, and they did not work. So we should learn what does work and what doesn't work. I like the idea of cutting taxes rather than giving people handouts. And one other quick thing, Pat. The aid that we give to workers and to businesses, it should all be in the form of a loan to let people get through the next 3 months. But then I believe the taxpayers should be repaid that money from these businesses.
Steve, one last question. Yeah. A lot of people are looking at their 401s. They're looking at their brokerage accounts, and things are down pretty substantially. Do you see the market coming back in another few months, maybe?
You know what? I'm so glad you asked this question, Pat, because I should have started with this. And look, I'm not a great financial advisor, but I feel very strongly about this. And people who have 401ks, or you have college education funds, or you have your savings in the stock market, do not sell stocks right now. You make a big mistake. This is one of the big mistakes that people make. In a down market, people get afraid and they sell their stocks. And I'm here to tell you, Pat, I don't know if the sell-off is over. The futures are down this morning. So, we could have a few more days or weeks of sell-offs. What I am saying is you have it exactly right, Pat. If 2 years from now, 3 years from now, you look at these stocks right now, the blue chip stocks, the main companies in America, the companies like, Google, and the companies like FedEx, and the companies like Amazon, and those companies, they're going to come back strong. So my advice is actually do not sell your stocks in this down market. And in fact, I'm actually looking at buying stocks right now because they're so cheap. And, 2 or 3 years from now, you're going to look back and say, I doubled my money. So That's my advice to people. And by the way, we're going to get through this, Pat. We have a sturdy economy. We have a president who understands how the economy works. And we're going to have what's called a V-shaped recession. There's going to be a recession for 2 or 3 months, and then the economy is going to boom out of this. I really believe that.
Steve, I totally agree with you, and I also agree if it's possible to load up on cheap stocks, it's a smart way to do. And Warren Buffett's guru was saying you don't worry about, quote, the market, and you don't sell when stocks are low. So you buy. So, Steve Moore, good advice. Thanks so much for joining us.
Thanks, Pat. Have a great week. Take care.
You too, buddy. Well, CBN medical reporter Laurie Johnson is here to talk about the fight against coronavirus and what you can do to protect yourself. And a new study, Laurie, shows that this virus might be more contagious than originally thought. You want to talk about that?
Yes, Pat. Health experts are issuing new warnings about how long the virus can stay suspended in the air. A new study published in the New England Journal of Medicine shows that the virus can be suspended in teeny tiny little particles called aerosols for 30 minutes before slowly drifting down. And to give you an idea of what they're talking about, this is hairspray that comes out in aerosol form. And imagine, though, that it's the virus and I'm coughing or sneezing it out. You can see how it becomes suspended there for a little while before finally drifting down. And you can also see why we need to practice this social distancing. We're being told to stay 6 feet away from each other for exactly that reason. A lot of people don't realize 6 feet is actually kind of far away. And to give you an idea, my arm is about 24 inches long. This stick, this yardstick, is 3 feet long. So add 10 more inches, and that's 6 feet. That's as far as we should be standing away from each other. So make sure you do the social distancing. Stay home as much as possible. But if you have to go out, only go out for those necessities like groceries. And when you do go out to the store, try to go first thing in the morning, because that's when the stores are freshly disinfected. A lot of stores are closing early so that they can really wipe down the entire store. Some stores, Pat, are even having senior hours first thing in the morning, like Dollar General and Target. The first hour of business every Wednesday, seniors only. So take advantage of that, everyone.
Laurie, talk about the influenza. What is the difference between the contagion of influenza and the contagion of the coronavirus?
They say that the coronavirus, if a person has the coronavirus, they're likely to give it to 2 people, actually a little bit more than 2 people. And for the flu, it's a little bit less than 1 person. So this is why it's so important for even people who are well, because so many people who feel just fine actually have the coronavirus. They may not even have any symptoms, but they are contagious. So you think about the math. 1 person gives it to 2 people. Those 2 people give it to 4 people. Those 4 people give it to 16 people, and so on and so on. And that's why it's so important, especially for the next 2 weeks, for us all to do our part to stay home and not get sick and give it to other people.
What do you think is going to happen in 2 weeks? Well, why is 2 weeks so important?
Well, this is what they're saying is our window of opportunity. Right now, we are where Italy was 2 weeks ago. And so this is kind of the place right now, this moment in time, where we can really tamp this down, flatten the curve, because we know that the number of cases and the number of deaths is going to go up. But we want to avoid what happened in Italy, where it went so high that the healthcare system cannot manage all the cases. And so we have older people who are being denied care and instead being read their last rites because the healthcare system can't handle it. And there aren't enough healthcare workers because an estimated 20% are getting sick, and so they are not able to care for patients. That's what we're trying to avoid. So within the next 2 weeks, this is kind of a critical period to keep our cases as low as possible before it becomes so massive that our healthcare system can't handle it.
One last question. They used to use quinine to fight malaria. Are they bringing out some kind of quinine or to fight the coronavirus? Maybe it's going to be an effective drug?
This is what is so exciting. While the American public is doing their part to avoid getting sick and avoid passing it along to other people, we've got these researchers who are working 24/7 to figure out, number one, a vaccine, and that's on the fast track, and then also therapeutics, ways to treat people who have coronavirus or to prevent people from getting it. And there are all kinds of exciting things going on in that realm. And what they're really looking at are drugs that already exist and seeing how well they battle coronavirus. Drugs that have been used for HIV, drugs that have been used for Ebola, and yes, drugs that have been used for malaria. These are being tested right now, but these anti-malaria drugs also are showing some very promising results as far as being able to protect people from getting coronavirus, prophylactically, that we might be able to give, especially to our healthcare workers. Because remember, these folks can't keep 6 feet distance from people who have the disease, who are coughing and sneezing on them. So they need to do more than just wear the mask. They need to protect their eyes and their ears and any small cut on their body. I think about men who shave and have little cuts all over their neck. So these healthcare workers need to wear those full protective uniforms, PPE, personal protective equipment, so that they don't get the virus. And that's what we need to make sure we have a good supply of those PPEs for our healthcare workers.
Thank you. And by the way, that 6 foot, that's going to kill romance, isn't it?
Yes. Leave it to you to bring that up. Yeah. So we need to remind our millennials who like to be close to each other and kiss and so forth that they need to think about their parents and their grandparents, because these millennials, they know that they're probably going to recover just fine, but they can spread it. And eventually one of these millennials is going to be in close contact with someone who is at very high risk of having serious complications or death from this. So this is why the millennials really need to step up. And also the Gen Xers and the Gen Zs, all those young people.
Whatever. Now, you got to give up certain drugs. You've got to give up romance, and you've got to give up investing
Not
in
if
the
you're
stock
sequestered
market.
with your husband, you don't have to give up romance.
Oh, with your husband. Okay. Assuming he doesn't have something otherwise.
Right, assuming you're both healthy.
All right, separate bedrooms. All right. Well, in other news, Iran's own leader admits that millions of Iranians could die from the coronavirus. And Secretary of State Pompeo is calling out the region for ignoring that problem. Ephraim Graham has more.
Pat, Iran continues to be the epicenter of the coronavirus in the Middle East. Just today, the country reported nearly 150 more deaths. U.S. Secretary of State Mike Pompeo criticized Iran for its response to the global pandemic.
Instead of focusing on the needs of the Iranian people and accepting genuine offers of support, senior Iranians lied about the Wuhan virus outbreak for weeks. They know the truth. The Wuhan virus is a killer, and the Iranian regime is an accomplice.
Despite his criticism, Pompeo said America stands ready to help the Islamic Republic in any way it can during this crisis. The Department of Health and Human Services is advising faith-based and community leaders on best practices to handle the coronavirus, including frequently asked questions like what precautions to take when gathering and what to do when someone is diagnosed with the virus. There are also links to all the latest resources, the Center for Disease Control and other government agencies. You can find those at our special coronavirus page at cbnnews.com. The latest guidance from the CDC recommends avoiding gatherings of more than 10 people, including church. The situation is forcing pastors to find new ways to serve their congregations. Charlene Aaron has more.
Growing concern of this global pandemic is taking a major toll on houses of worship. Many have closed their doors, taking the message of Christ and hope online. From Rick Warren's Saddleback Church.
Historically, Christians have always moved into the pain when everybody else moved out.
To the Potter's House with Bishop T.D. Jakes.
During these COVID-19 developments, we aim to be a comfort in the middle of chaos.
Millions attended church last Sunday in front of a screen from their smart TV, laptop, or cell phone. It's the new normal as churches close their doors to help prevent the spread of COVID-19. Nona Jones leads Facebook's faith-based partnerships. She told CBN News about the growing number of ministries utilizing the platform as a way to keep spreading the good news.
There's been a pretty significant surge in the number of not only live streams, but also people viewing worship online. And I think one of the things that's really important is for everyone to know, Facebook is free.
Jones also believes the crisis can be used as an opportunity for the church to use technology to its advantage.
I think the faith experience has been so narrowly defined to be a building, when in fact we're discovering through this situation that the faith experience doesn't have to happen in a building. It can actually happen wherever you are.
For example, thousands recently attended an online prayer meeting hosted by several ministry leaders, including Jones.
We had over 200,000 people from all over the world tune in, and that number has continued to climb as people are finding that archived video even today.
Autumn Miles is taking her ministry to Facebook, urging her more than 130,000 followers to join her in a day of prayer and fasting on March 20th.
Fasting is a supernatural secret weapon. When we as believers start engaging in sacrificing things that we normally don't have to sacrifice, the Lord seems to show up in a supernatural way.
She hopes that includes a supernatural end to the deadly virus.
I'm calling for us to deny ourselves food, except for medical reasons, of course, but to deny ourselves and focus on the Lord. God is more powerful than this COVID-19.
Meanwhile, a new website sponsored by the Billy Graham and Humanitarian Disaster Institute at Wheaton College is helping churches engage in online ministry. Charlene Aaron, CBN News.
Certainly a time for prayer and fasting. Pat?
Well, I must say Regent University is going to graduate about 2,200 people. We usually have as many as 20,000 people in the audience, and we're trying to put together an electronic graduation where it's seamless, where the people are named and you identify them, and you have to give the degree and all the stuff that goes along with it. It's got to be done electronically because we can't have that big a crowd. You can't have 20,000 people.
Wow, unprecedented. That's never been done before.
Never been done. So we're trying to work out the details, but that's just one of the challenges. But so many colleges are canceling graduation, so how are you going to do it? Well, our people have come up with some very unique ways of doing it. They'll have a degree in the mail, and then this will be an electronic service where they'll be granted the degrees electronically. But anyhow, we're all being stressed for as much creativity as possible. Well, Wendy, you've been doing a story about Guatemala. You want to tell us more about it?
Absolutely.